Welcome back to Pure Root Wellness. I am Danielle, and the topic today is going to be minerals. So here, just in the first slide, kind of just showing, I'm more of a visual learner, like a visual depiction of, certain minerals that we need pretty much essentially every single day, and kind of the associated percentage of minerals incorporated in certain food groups. Nothing really to kind of go over, but again, just kind of more of a visual. If you're knowing you're minerally deplete in certain areas, you can just briefly look at this and say, oh, I see that. I'm depleted in calcium. Radishes have 63%. Daily serving of calcium that's incorporated in that food group. So nothing really to talk about, but just kind of a visual depiction of, the minerals and associated kind of food groups, basic food groups for consumption. So what is a mineral? It is a natural occurring element found in the earth. So i.e. rocks, stones, crystals. Every single living cell on this earth actually depends on minerals for proper functioning. It helps to maintain body fluid, formation of blood, bone, nerve function, muscle tone, heart health. They are truly a big component of functionality within us as human beings. They act as coenzymes, meaning that the mineral really helps to speed up a chemical activity in the body. And typically these minerals are stored either in the bone or in the muscle. For when we need them, when we're deficient, obviously that's when we start kind of tapping into these areas of bone, muscle, mineral depletion, and that's when it starts showing up in more of a laboratory value that we are depleted or deficient in certain minerals. The best form of mineral supplement, just kind of generalized, is the chelated form. These minerals are actually bound to protein molecule that transports them into the bloodstream for really enhanced absorption. So when you're looking at certain minerals for supplementation, really looking at a chelated form really will give you more bang for your buck in regards to better absorption. It's important to know if you eat mineral supplements with a meal, they also will become kind of chelated naturally, especially if there's protein that can be protein bound too. That kind of is another reason why we say a lot of times with a multivitamin, with mineral supplements, consume them with a meal to help kind of transport all of those important vital nutrients to where they need to go to either be used up or stored. And then absorption of minerals can actually be decreased or worse if you're taking them with fiber. So kind of planning around maybe what your meal will be for that day. If you know it's a high fibrous meal, maybe not the best time to take, your multivitamin or your multimineral, during that time frame, and finding something that would be a little more protein bound would probably be more efficient from a health standpoint. So we're first going to delve into macro minerals, and we'll start with sodium. Sodium really is an element that maintains water balance in the body. It helps to improve kind of stomach, nerve, muscle function. And, when you're thinking of salt, everyone kind of thinks of like the table salt, which it actually has sodium and chloride in it. Sodium chloride, that's what is table salt itself. But for the longest time, we've kind of learned that excess salt can cause issues with hypertension, bone depletion or osteoporosis, dehydration. Extra sodium means that you need more water, but if you don't drink enough water, your body will actually pull water from the cells. That's what actually kind of tells your body, hey, I'm thirsty. It removed kind of the water from the cells, and there's a lot of sodium water shifting within those cells. Vascular and cardiac damage with, high blood pressure, that kind of goes hand in hand with the hypertension itself. Obesity, they have found kind of links that too much salt really leads to the heightened thirst levels, greater intake of calorie dense drinks, and kind of along with that comes obesity. There have been some links with sodium intake and stomach cancer. The fact that it can kind of damage the walls of your stomach, raising the risk maybe of infection, inflammation, and potentiating possibly the effects of developing stomach cancer. And then kidney stones. Calcium is really flushed out by the kidneys. So when there's too much salt actually in the diet, this can cause the kidney stones to develop. And this is more kind of true for the female gender versus male, but obviously this can still occur with the male population as well. So when you become actually deficient or hyponatremic with sodium, certain medications can do that. Diuretics are one of them. You know, a lot of people take a water pill every single day. You know, where water goes, sodium will follow. So it's sometimes not easy, or it is easy to become hyponatremic or sodium depleted when you're on certain diuretics. This can lead to a lot of issues with cramping, confusion, weakness, headache, lethargy. Some people get palpitations, have low blood pressure, they start to vomit. These are all kind of signs and symptoms that the sodium may be a little too low in the body. And then an excess of sodium, hypernatremia, too much, causes, again, wherever sodium goes, water will follow. You start really swelling the cells up. So i.e. you get swelling kind of throughout the body itself, your blood pressure goes up, your potassium goes down. That's kind of by way of the sodium potassium pump and channels that naturally occur throughout the body. And you can actually start to develop some liver and kidney issues as well when the sodium remains high. What's interesting is almost virtually all foods contain some form of sodium. So even though you may be kind of counting your sodium intake, there may be kind of negligent sodium in certain produces and foods that you weren't fully aware of, that weren't on a package label. We generally recommend about 2.3 grams or 2,300 milligrams, or about 1 teaspoon a day of salt or sodium. And the big question really is, well, what kind of salt is the best salt? You know, really looking at sea salt versus table salt. The sea salt is actually produced through an evaporation of ocean water or water from saltwater lakes, usually with little processing that goes into this. So table salt is typically mined from an underground salt deposit, and table salt is more heavily processed to eliminate the minerals and usually contains more what we'd call like additives to prevent clumping. Himalayan pink salt is harvested from the mines of Pakistan. Its pink hue actually comes from small amounts of iron oxide, and that's similar to sea salt as well. It's kind of less processed. So you can see the picture there where you see the Himalayan pink salt, and then you see the sea salt, and then kind of the more processed table salt. In general, I would work from the left to the right if given the options of what salt to ingest, if you were going to add certain salt to your food. Potassium, another important mineral to talk about. It helps to regulate heart rhythm, helps with nerve impulses, transfers nutrients within the cell. It's really present in all body tissues. When someone is depleted of potassium, it actually can cause issues with circulatory damage. Again, you deal with lethargy or being very tired. Constipation or even diarrhea can follow. You can go kind of either way with that. Your heart rhythm starts to become kind of irregular. This can cause issues with glucose or sugar intolerance. And again, this can also aid, in whether or not kidney stones develop, whether there's too much or not enough potassium in the system itself. And there is some research looking into the development of maybe high blood pressure when you are hypokalemic, low potassium. And again, this really has to do with a lot of maybe the sodium potassium pump channels, a 3 to 2 kind of ratio of sodium to potassium, and a correlation there between the two basically ions. With low potassium, you can also get the nausea, the vomiting, the headaches. Again, you're looking at diuretics, laxatives. Tobacco, caffeine can disrupt the potassium absorption, which is something important to kind of take into consideration. I know, the general public typically takes in quite a bit of caffeine throughout the day, and just know that you may be altering your potassium levels with drinking lots and lots and lots of caffeine throughout the day. But looking, just kind of at consumption, you're at about 2.5 to 3.5 grams of potassium a day. Typically, you don't need to supplement your potassium. Again, you can see all the foods that potassium with lies in, it's typically not that difficult to get enough potassium into your diet unless you are taking certain diuretics, have, diarrhea, you're losing a lot of potassium from a gastrointestinal aspect. Calcium. Calcium is obviously important for promoting strong bones and teeth. This also can help to regulate your heartbeat, keeping your blood pressure in check, lowering your cholesterol. Muscle cramps can come about if your calcium tends to go one way or the other. Calcium really helps with providing energy and actually helps structurize the RNA and DNA, the actual genes that are kind of the backbone of us. So really making sure that your calcium is up to par and repleted is very important. And when you are looking at someone who is deficient in calcium, they typically will complain of achy joints. Their nails may be brittle. Eczema will ensue, a lot of skin issues. We tend to look at the calcium as well. High cholesterol and blood pressure. Again, not enough calcium can cause some low blood pressure just based off of what it does to the vasculature alone. Muscle cramps and kind of that feeling of nervousness sometimes follows with a deficiency in calcium. What's interesting is lysine, which is an amino acid, is actually needed for calcium absorption. So, if you're lacking certain proteins and your albumin is kind of low, you're kind of nutritionally deficient. It's very important that you get that amino acid with the calcium for better absorption. It's always kind of been known not to take calcium and iron together. They kind of off kilter one and the other. So it's really important to, if you are going to take multivitamin, I typically don't have iron in my multivitamin for this reason alone. But if you do need iron repletion, whether you're anemic, it's important to kind of offset those two and make sure that you're not taking them together. And then looking at like diets high in phosphorus. So if you're ingesting a lot of pop, a lot of meat, a lot of sugar, this will all lead to calcium depletion, period. The phosphorus itself have a kind of communication between calcium and phosphorus, and when one goes down or one goes up, the other can go down. And really foods high in pop, soda, meat, sugar all will not help you from a calcium repletion standpoint. And really looking at how much you should be taking in for calcium, it's about 1 gram or 1,000 milligrams to about 1,500 milligrams a day. Again, it's best when taken in smaller doses, like 500 2 to 3 times a day. But limiting factors of life and just existing, I know that can be challenging to remember to take 2 to 3 times a day, certain supplements and minerals. So, if you have to get it in one way or another and it's one time a day, so be it. But truly the best approach would be, doing 2 to 3 times a day of 500 milligrams. And just a little caveat here, just because I do see some patients that come in, they're on medications, what we call calcium channel blockers for hypertension, for arrhythmias. You really need to be careful when you're taking additional calcium and you're already taking a calcium channel blocker. All of these can interfere really with the effectiveness of the medication. You may be counterintuitive when you're trying to supplement a calcium, but also the patient remains on something that should be blocking a calcium channel. So really being cognizant and paying attention to what pharmaceuticals you're on, and then what should we do about repleting and how do we go about doing that. There's always been kind of some controversy with calcium and, do calcium supplements, do they appear to increase the risk for kidney stones? The research really doesn't show this, but if you do have some underlying kidney disease, you actually should be talking to your primary care doctor or your naturopathic doctor about supplementation before you just go ahead and start ingesting calcium. When the kidneys don't work as well as they should, they hold on to that calcium. And if you keep adding more on and the kidneys aren't able to filter that out, you can start running into some issues basically with cardiovascular issues and other complications. And one of the researchers actually looked at men who consumed about 2.5 servings of dairy products per day, which equated to about 600 milligrams a day. They had a 32% increased risk for prostate cancer. So, I know I kind of talk about in my milk dairy podcast about really how milk doesn't do a body good, how milk can actually be detrimental to bone health and doesn't improve, decreasing the risk of bone fractures. But we also are starting to see that these dairy products are increasing risk for certain cancers as well, and prostate being one of them. And interestingly enough, the low-fat dairy product consumption was actually more harmful than the dairy with full fat. So just something to kind of keep in mind when everyone says, oh, I drink a lot of milk, I get up my calcium that way. Really understanding what the research and the science is kind of showing may change the way you kind of look at supplementing, i.e. some of the foods that are on the bottom portion versus maybe the top in regards to dairy consumption. Phosphorus, also another important mineral to talk about, helps with blood clotting, bone and tooth formation, cell growth, heart contraction, kidney function. It actually converts our food into energy, ATP, which is how we just function as human beings. It can help, it's really kind of one of the backbones to developing like DNA, RNA. You can see down at the bottom there, you have a DNA biochemical framework and then an RNA biochemical framework, and you can see that phosphate is an arm projecting off of that kind of ribose sugar. That is actually the backbone of the DNA. So something that helps us as humans to continue promoting new cells and truly functioning as human beings. Looking at deficiency of phosphorus and lack thereof, it's very rare that people don't have enough phosphorus. If you do, people tend to have a lot of anxiety, bone pain, fatigue, weakness, numbness. Personally, I see this in my surgical ICU just with dialysis patients. When we're running them on dialysis, we start to have some phosphorus depletion or, too much repletion that we need. And patients who are very nutritionally deficient, we start to see the phosphorus start to become an issue. And excess phosphorus will actually stop calcium uptake. And when you're getting excess phosphorus, you're getting this through processed food, junk food, pop again. Soda pop, it just always comes to my mind when thinking of phosphorus and what it does to the body itself and how it affects kind of a down trickle stream of all of these other minerals and processes that the body needs. The body just can't use any type of pop, diet or regular, for anything beneficial in the body. And then vitamin D actually increases the effectiveness of phosphorus. So using them synergistically together might actually help one and the other, which is very important. Magnesium, another very important mineral, macro mineral, in the essence of it being a cofactor. It helps with over 300 enzyme systems, which is ginormous. It really helps with energy production. It protects the arterial lining of the blood vessels. And it's important to know that during pregnancy, repleting your magnesium, it can lower the incidence of developmental delays in children. So really making sure that you're getting your good multivitamin while you are pregnant, even still breastfeeding, can be very, very important. And this actually came out of JAMA, where they actually put a numerical value of 70% lower incidence of developmental disorders with moms who took magnesium, and 90% lower incidence of cerebral palsy. So very important type of macro mineral to make sure you're ingesting, especially during pregnancy as well. The lack of magnesium, you'll start to see kind of the nerve and muscle impulses. You can see twitching, irritability, dizziness, PMS symptoms, insomnia, irritable bowel syndrome, chronic pain syndromes, and then the formation of kidney stones as well can be an issue. Lower magnesiums basically just kind of make every disease process kind of worse. That's kind of a generalized statement. But again, if you don't have enough of this cofactor driving these enzymatic systems to produce energy and help with blood vessels and kind of all of these functional activities that the body needs, you can't stay at optimal health for long, and unfortunately your disease process may worsen. Really only looking at about 300 to 400 milligrams a day is really all you need. And the intracellular magnesium that we screen for is actually a more sensitive test than the serum magnesium to detect deficiency with more accuracy. So remember that most of the magnesium is actually inside the cells or the bones. So I know sometimes when we go and get our blood tests, we're looking at the serum magnesium. What's important to remember is the intracellular, the inside the cell magnesium is probably what is a better depiction of whether you have a magnesium deficiency or not. And then one small study actually found that magnesium in aspartate, citrate, lactate, and chloride forms is actually absorbed more completely and is more bioavailable than magnesium oxide and magnesium sulfate. And typically that's what we use a lot in-house. Is if the patient can take something orally, the mag oxide is what's given, the magnesium sulfate is the intravenous form. But the fact that the aspartate, citrate, lactate, or chloride may be more absorbed completely and is more bioavailable is something that at least us as practitioners need to be cognizant of when we're trying to replete someone with hypomagnesia. Big picture about all of this, though, be very mindful that most laxatives like milk of magnesia, heartburn medications have magnesium in them. So if you're going to overdo it with magnesium, be close to a bathroom because code brown could happen sooner than later. Helps with ridding the system very efficiently. And the last macro mineral that we'll talk about is sulfur. And we don't talk much about sulfur. It's an acid-forming mineral. It actually helps to disinfect the blood, helps resist bacteria and protect the cells. So obviously, maybe not spoken about much, but has a very important role in keeping us healthy as humans. Protects us against harmful radiation and pollutants, can actually help to slow the aging process down, and is still found in all body tissues, which is pretty cool. It's needed for collagen, basically the protein in the body that gives the skin its integrity. So very important if you're, conscious about your skin and wrinkles and things of that nature. Sulfur is something that you want to make sure that you're very replete in. Sulfur itself, and this kind of goes into, I guess, piggybacking off of lack of or deficiency of sulfur can cause some memory problems. Sulfur can help stop the hippocampal cells from dying off as we age. And interesting, they are kind of finding that diets that are rich in sulfur may help to improve people with underlying dementia. So again, something else maybe to kind of be cognizant of. Deficiencies can cause depression, or you can see issues with depression, weight gain, and then chronic fatigue syndrome. That's still kind of looking into as far as research-based and what have you, but there is some, again, not causation, but maybe a little correlation there with deficiency in sulfur and how that develops into potentiating maybe a chronic fatigue syndrome. And interestingly enough, when there's a lack of sulfur, there's actually lack of methionine, which is an amino acid that helps to break down fat, and also an antioxidant. The antioxidants basically which inactivate free radicals. If there's lack of sulfur, there's lack of antioxidants throughout the system as well. So again, kind of the forgotten maybe macro mineral, but has a very important role in our health and us existing healthily in our bodies. So I will stop here and we'll talk about trace minerals next.